Today, I'd like to talk about the ketogenic diet and type 2 and type 3 diabetes, but mainly type 3 diabetes. You may know that under another name, dementia and Alzheimer's. There's been many studies, much research done, and they now have a word for it, a couple of words for it, type 3 diabetes. Let me back up just a little bit. While doing research for my book, which started back in 2012, I uncovered a lot of information. One was the use of the ketogenic diet in the treatment of epilepsy. I stumbled across a brochure from the Salt Lake County Board of Health, and the #1 treatment was the ketogenic diet. And some things began to run through my mind a little bit about if the ketogenic diet will stop seizures, what else can it do as far as your cognitive function is concerned? And so I started doing more and more research, and we're finding out that lifestyle has much to do, especially the eating habits, with cognitive function. And in fact, right now, not only do they treat epileptic patients with the ketogenic diet, but people that have dementias and Alzheimer's, Parkinson's, multiple sclerosis, they're also using it, and there's a number of other things that they're doing. But it became pretty evident. We have a meeting every Thursday at 6:30 in Salt Lake City at Dave's Health and Nutrition. And we had a little discussion about it last night. And one of the things that came up was from one of my clients who's 85 years old. And he was telling me about his wife, who has really embraced the ketogenic style. She's lost, she went from 189 pounds down to 155 pounds, and dropped her A1C from 9.6 to under 6. And she's in ketosis. And one of the things that she likes to do is math. And she's been having a lot of trouble with it over the years. She used to be really good at it, and lately she just wasn't able to concentrate and focus on what she was doing. And I'm happy to report that she is now able to do her math again. And this is not unusual with the ketogenic diet. What happens is when you consume a lot of carbohydrate and sugars, it messes with your brain. It keeps you tired. You can't focus. You can't concentrate. It's an inflammation that's in your brain that's caused by the foods that you're eating. And the ketogenic lifestyle, the ketogenic diet is the answer to helping this problem. We actively encourage you to look into the ketogenic diet. That is it's a high-fat diet. 80% of your diet should be fat anyway, 15% protein and 5% carbohydrate or less. But I won't go into that. I'm going to come follow this up with another video. I talk about another thing that will help you with cognitive function. Most of the people that we get at these meetings are up in their ears a bit. I'm 71. I'm the head coach of Carb Watchers, and I've had diabetes and heart attack, and I was on all kinds of medications, lost 70 pounds and kept it off for 4 years. And I know that my cognitive function has improved. I used to forget things and have trouble concentrating on different things. And maybe you can relate to this if you're up there in a few years and you're trying to work with a new VCR and you're trying to tune it in and get it set up, and you just can't seem to concentrate, can't seem to get it done. You'll find that this ketogenic diet will help you a lot with that type of situation. So we want to keep you informed with this type of information, and we'll keep firing away. And I'm going to follow this up with one on L-arginine and what that can mean for cognitive function. And thanks for tuning in, and talk to you in a few days.